Hello, I'm Dr. Brant Gibson, and we've been talking about peripheral neuropathy. And I want to teach you about the test, the nerve testing that you can actually be done in an office to quickly determine if you have a peripheral neuropathy and to give you a better diagnosis of what's going on. And the first test that I'd like to talk to you is the monofilament test, which is the light touch. Monofilament is just a little wire, and I wish I had one here. I actually left it at the office. I forgot to bring it so I could actually do it with this video. But the monofilament wire will be used to test 10 areas on each foot and to determine if you have a sensation at 10 grams of pressure. Now, the importance of 10 grams of pressure is that's how much pressure it takes to create a sore, create a wound on the foot. And so we use that to determine if you have the protective threshold or the 10-gram pressure sensation level. And if you don't have this light touch, of course, it confirms you have peripheral neuropathy. Just because you do have it does not mean you don't have peripheral neuropathy, because this is testing for a sensory neuropathy. It doesn't test for motor or autonomic neuropathy. So monofilament light touch, and what you're going to do is you're going to touch the first, third, and fifth toes. Then you're going to do the same on the metatarsals, first, third, and fifth. And then you're going to do medial arch, lateral arch, and the heel, and then the first inner space. So on the top of the foot, on the first inner space. The whole idea is you should feel every single one of these. And it should be simple. We touch and you should feel it. We do this usually with your eyes closed, so you can't cheat, but you literally say touch, 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 and you can actually save in location if you actually have normal sensation. The goal here is to determine the extent of your peripheral neuropathy. It also allows us to come back and test later to see if you're progressing, getting worse, or improving. And so this is the first test. This is one of the main ones that's done. This is probably the most common test that's done in many offices, especially for diabetics. You're going to have even many of the primary care doctors will do a monofilament light touch test to determine if you have peripheral neuropathy and if you have protective threshold or the sensation protection to keep you from getting diabetic wounds or neuropathic wounds and ulcers. This is Dr. Brant Gibson, and this is your Neuropathy Nugget, day 245. This is the monofilament light touch.